Okay, I have that we are just past the hour here. I imagine we'll have a few more folks joining in as we get started. But to keep us on time today, I want to welcome you all to our presentation today as a part of our Relying on Rural Resilience webinar series. Today we are joined by Dr. Melissa Barnett, who is going to be speaking to us about multi-generational supports. Today's presentation is titled, It Takes Three, Multi-Generational Support in Rural Families. My name is Brianna Routh, and I am the Communications Chair for the Rural Families Speak About Resilience Hatch project that is helping to make this series possible. And I am a extension specialist in food and family at Montana State University. And I am a member of a multi-state group that provides both research and outreach when it comes to rural families on all variety of topics, from health to economics to intergenerational supports. So we're very excited to have you all here with us today. Perhaps some of you have joined us at previous webinars, or perhaps this is your first webinar. But again, just to share with you a little bit about this series, we really hope to share a little bit with you of the research that we do within rural communities and engage with you as professionals in those rural communities to see how this information might relate or be relevant to strategies that you use in your everyday work. So after the presentation, we will have a short presentation, and then we will discuss in breakout rooms in order to get your insights as well. So thank you again for joining us today. And without much further ado, I'm going to turn it over to Dr. Melissa Barnett to share more with us today.
All right, thank you so much, Brianna, and thank you all of us for joining us today. I'm really excited to talk about this topic. It takes three, multi-generational support in rural families. And just as a reminder of today's objectives that you probably saw when you registered, are first to learn about research on multi-generational support networks from the perspective of rural families, to identify ways to apply these findings to your specific programming and community outreach, and three, to brainstorm strategies to develop resilience in rural families with other outreach professionals, so other attendees, and that's actually what we're going to spend a lot of time doing today. And we'll get there, but first of all, I want to start with a really brief reflection activity. And then I'll be giving a presentation where I provide an overview of some national data and then go more in depth with some findings that we have from this larger multi-state project. We'll then move into the breakout room discussions, and then we'll have time in the end for a whole group share back of what you discussed in those rooms. And so to start off, I'm really just going to take about 30 seconds for this, but just to take a step back and really think about who do you see helping families and the individuals you work with? And then who do you see them helping? And really thinking helping broadly, support being broadly. It could be financial support, it could be instrumental support, advice. And you're welcome to put that in the chat if you'd like, or just to kind of think about it or jot it down to have it in mind. And if these questions don't apply to the work that you're doing, maybe you can think about in your own life, who do you help and who helps you? Families, yeah. That's right. Local nonprofits in the chat. Yeah. Again, kind of keeping this in mind as we move forward today to talk specifically about multi-generational support. And so defining multi-generational support, generally it's thought of as exchanges of, again, it can be instrumental things, it can be advice, it can be food, it can be social emotional support, it can be housing across generally 3 or more generations. So you have parents, grandparents, and grandchildren. Although in some definitions of multi-generational support are 2 or more adult generations, so maybe adult children and their parents, for example. And this support is really common, although it might not be immediately apparent, especially if people don't live together. We may not see that in our everyday interactions with people, kind of who's in their network helping them and who are they helping. We know this kind of support is particularly relevant to understanding the lives of individuals in rural communities, where people may be more likely to rely on this kind of informal support than more formal support through, for example, nonprofit organizations, through government agencies, etc. And we know that this support can occur both within households. So the easiest and most apparent way to think about it is multi-generational households, where you have 2 or 3 or more generations living together. But we also know that it extends way beyond households and that people are helping each other even when they don't live together. And of course, this is variable or dynamic over time. If you look at one point in time, you may have a multi-generational household, but if you go back and talk to them later, maybe they've moved apart, or they moved in recently to get through something like a job loss. And so we really are taking a more dynamic approach to thinking about what do people do and who are the people who are doing this kind of support work. And these adaptations, forming these multi-generational support networks, can be extremely helpful to individuals and to families. And so they're a really important source of resilience, how families and individuals thrive in times of disadvantage or need. But we also need to think about how those adaptations that promote family resilience, or the family as a whole is doing well, may present risks to individuals. So for example, forming a multi-generational household, moving in together. There's actually national level census data that suggests that individuals who are living in multi-generational households are less likely to experience household poverty than individuals who are living in non-multi-generational households. So really adaptive in that sense. Family as a whole, but you can think about for some of those individuals who are living in those multi-generational households, those housing arrangements may involve conflict, or it may be that they're contributing to household expenses instead of maybe saving money that may allow them to live independently or receive further education or training. So we need to think about these costs and benefits, including what may benefit one family member. So for example, providing elder care in these multi-generational networks may come at some cost to other members, that younger generation that is trying to balance, for example, providing care for elderly parents, providing care for their children, and working outside of the home. I'm going to start by talking about, again, the most obvious form of multi-generational support, and that's when we see multi-generational households, so these generations living together. And we know that in general, across the country, multi-generational households are becoming increasingly common. So this slide shows some data from the Pew Research Center. This report came out a few months ago. They used US Census data, and you can see across the last 50 years, we've seen real increases in the numbers of multi-generational households. And in here, they define multi-generational as 2 or more adult generations living together. And certainly the pandemic led to some increases, but really just accelerated a trend that's been occurring over time. In particular, you can see there was also an increase during the Great Recession, for example, and then an increase during the pandemic. So we can see that in times of great economic need, we do see increases in these multi-generational household structures. And in fact, the same census data asked people why they were in multi-generational households, and economic need was almost 2/3 of the sample defined economic need as a reason to live together. We can also see from a national survey that Generations United conducted of people living in multi-generational households. First of all, that people who self-identify as Hispanic or self-identify as Black are more likely than those who self-identify as white to be living in multi-generational households. We also, looking nationally, we see that Asian Americans, as well as Native Americans, especially individuals who are living on reservations or in tribal areas, are also very likely to be living in multi-generational households. And this clearly is related to economic need, a lack of access to affordable housing, and then also cultural preferences and exposure to systematic disadvantages in some cases. And all of these factors also then are really relevant to thinking about families living in rural areas as well. And these also from this most recent survey from 2021, so there may be some pandemic influences here, but again, what happened during the pandemic just reflects what we were starting to see as national trends. Almost half of kids under age 18 are living in multi-generational households. So really just thinking about the prevalence and the importance of these kinds of household structures for children's everyday well-being and interactions with adults. But those households, again, are really this the tip of the iceberg, right? We know that, and they're the most obvious to measure, we can see them, but really underlying the daily survival of a lot of families is participating in these multi-generational support networks. And as I said earlier, there may be variability over time. Like when do you live in a house with multiple generations versus when are you giving and getting support from those generations? And this means that often when we're asking questions about social support, both as researchers or when you're asking individuals in the programs that you're managing, that you're implementing, who helps you, you're very often asking about multi-generational support, even if you're not using those terms or you're not asking specifically. And that became very apparent, and I'm going to sort of dive into the data now, data that come from this large multi-state project, the Rural Family Speak project, or Rural Family Speak about Resilience Now is what it's referred to. And so I'm going to talk about some findings from a paper some colleagues and I published a couple of years ago that were based on semi-structured interviews with economically disadvantaged mothers living in rural communities. And really importantly, these questions in this paper did not start out to study grandparent involvement. Mothers responded to 3 general questions about social support. Who are the people in your life that help you? What helps you or prevents you and your family from being healthy? And who helps you parent your children? 86% of the mothers mentioned grandparents. They mentioned grandparents on average 5 times in response to those 3 questions. And the range of mentions of a grandparent or a great-grandparent was 1 to 31. And when I say grandparent, I mean the child's grandparent. So the mother's parent or in some cases, great-grandparent. One of the most striking themes from these interviews was reciprocity. So it's not that we saw a lot of, just top down. So it was the older generation helping the younger generation, or the younger parent generation helping the older generations. There was a lot of back and forth, and this included kind of across time, or even, so my mother's taking care of my kids, but then I drive my mom to her doctor's appointments. So really thinking about these back and forth kinds of interactions that, again, we often miss if we just asked, do you have support available? And we don't ask about, well, who else are you supporting and what might be some of those reciprocal obligations? We also found that it was very uncommon for mothers, again, to only mention this multi-generational support in the context of one type of support. And the most common things they mentioned were emotional support, financial support, so very much in line with the national findings, and very important in thinking about rural families, support related to childcare and to transportation. And this is in line with this national survey of multi-generational households, where again, the resounding reason people said they were living together in households, and we can think about, that's just the tip of the iceberg, were for economic reasons. But then more specifically, we can see this is complex, right? People could select more than one response here. So about 1/3 of the sample for elder care, 34% for child care, related to job loss, healthcare costs, cultural and family expectations. So not only because of need, and I think that's important to point out, but lots of reasons. And we saw that reflected in our data. Related to both the combination of financial and childcare benefits, Charlene, a full-time employed and divorced mother of 1, said, if it weren't for my family, I would have a hard time. I'd have to take time off, and that's hard to do. Her parents were providing childcare for her children. They were also picking up her children after school. And so this is really allowing her to be able to work. So the childcare also came with important positive financial ramifications for her. And we saw in some families this multi-generational support was providing a pretty effective safety net, especially if it was temporary or it was for some extras. So some parents talked about, for example, grandparents would buy extras like paying for school pictures for kids. Or when there was a particular time of need, like Jenna, a married mother of 4 who recently lost her job. My mom buys us $100 worth of food every month, and usually that's meat and granola bars. So really being able to rely on the mother for a regular contribution during this time when she had lost her job. The mother herself had lost her job. But these financial safety nets aren't effective when you think about chronic needs and low resources across the support networks. So Chris, a self-employed mother of 3, said, my mother helps me financially when she can. So this idea of, yes, they want to help each other, but they may not always be able to provide this kind of support. We also had a number of respondents who talked about the caregiving burden here. So Roxanne, a 36-year-old mother of a 6-year-old and 2 teenagers who was working full time, she's actually talking about a 4-generation network. So she's sort of a double sandwich when we talk about the sandwich generation. I have an elderly grandmother and I'm the only grandchild. So all of that responsibility falls on me. She's 85. I have a sick dad also. He has kidney failure and all that stuff, and I'm the only child for him. So again, zooming back out to think about this in a rural context where we tend to have health disparities, perhaps higher rates of morbidity, Charlie, Roxanne, and many of the other mothers are providing really critical elder care, but at what cost to themselves? And again, we think about grandparents being a really important source of child care, but not in all families, because here the grandparents may not be healthy enough to provide that child care. So here we have an elder care benefit. We also know that these multi-generational support networks can come with conflict. Related to family history, we've been having the same argument for the last 20 years. Certainly related to some clashes in generational values, and that this conflict and this support often go hand in hand. They're very much connected. So for example, Lucy, a 19-year-old single mother of a baby who at times lived with her own mother and relies quite a bit on her own mother for financial and childcare, says, you shouldn't get divorced. You shouldn't have a child out of wedlock. You shouldn't do this. You shouldn't do that. I mean, for as much support as she gives me, she puts me down a lot. So this idea of feeling obligated, this is where you're getting your support. But again, it comes at cost to that individual, to the parent. We also found in our data, and this is really reflective of national research, some potential sources of conflict between parents and grandparents, specifically around parenting beliefs and practices, especially discipline. A number of mothers mentioned discipline, nutrition, health and safety. So these really critical parenting behaviors where there might be some generational differences or sources of conflict. Eve, for example, a single mother of a 6-year-old, said, when we go to my mom's, she just don't know how to cook without grease. It's not really healthy, all the grease. So her mother was actually providing a lot of childcare. She was regularly providing meals for the family, but that wasn't in line with the kind of meals that Eve wanted to be providing for her family herself. So overall, then, thinking about what this all means is that when we're thinking about conducting needs and assets, either at the community level or the family level, really think about this multi-generational and multi-household perspective to really understand who's helping families meet their needs, whose needs are they helping to make, and how is this a potential resource or real asset, source of resilience, and when might it present some risk? And really, I'm trying to understand reciprocal health and well-being within families. And if you're really focused on one generation, what does this mean? How is the other generation doing? Because that might impact how the old grandparents are doing and how parents are functioning. And that even when programs aren't explicitly multi-generational, there may very well be some multi-generational components. So maybe it's a positive parenting or discipline program. An important element to that might be, how do mothers or parents who are participating have conversations with others in their support networks about what they're learning? Or similarly, a nutrition program. If they want to be using healthy eating practices at home, how do they need to negotiate that perhaps with their own parents? Is it possible to use a sort of train the trainer model to bring home and really thinking about the effects? Or if it's an elder care and you're you're seeing elder care needs are met, great. Maybe digging a little deeper and thinking, who's providing that kind of care and at what cost? What other supports might that family need? So I'm going to stop talking now, and we are going to thank you for listening. And I would love to, if you have questions or want to learn more about this, I'd love to talk to you.